Okay, everyone. I think we're going to get started. It looks like almost everyone's here, but we're not going to waste your time any longer. Welcome. If you can't hear us, you can let us know in the chat section. Just let us know. Well, I guess you wouldn't be able to tell if you're hearing us or not, but I will say something in the chat if you can't hear us. Otherwise, we can get started. So today we are going to be covering the ICD-10 software updates. Myself, Mark Spielman, along with Brandy Stippen, is going to be showing you guys all the software updates and how to function those in the system. So basically we're going to be, it'll be about an hour meeting. If you guys can see the GoToWebinar panel, you'll see a couple of different options. Like I said, the chat function. If you have questions at any time, you can ask us in the chat section. We will open it up for questions over the phone during certain segments of the webinar. And that's pretty much it for the general rules here, and we can get started. So currently everyone is using ICD-9s. You should all know that by now. ICD-9s are your diagnosis codes that you're currently using for your patients. These are going to be continued through 9:30. If you already haven't heard, you should have by now from multiple people and multiple different insurance companies or resources that ICD-10s are going to be starting on 10/1/15. This has been delayed for a few years, and so this is the start date on 10/1. So starting 10/1, you are required to start using ICD-10 codes. The difference between ICD-9s and ICD-10s, if you generally speaking, if you haven't, gone to a seminar or looked much into it, is the ICD-10s are much more specific. They'll give you a lot more options from your diagnoses as opposed to the ICD-9s. So an example that we're going to show you is like a 7243 sciatica. There's now 3 options on ICD-10 that will show you M54.30 unspecified, either the right side or the left side, and you will have to decide and diagnose based on your patients, according to that specificity. Basically today what we're going to be showing you are the updates to software, and you will be able to do some certain functions and have some resources as far as mapping your ICD-9s to the equivalent ICD-10s. We're going to look at some different reports to show you some resources as well as how to identify the ICD-10s from the ICD-9s. The majority of what we're going to talk to you and show you today on the software is what we're calling pre-staging. So these last 2 weeks of September, we will show you how to get your ICD-9s to ICD-10s ready come 10/1. That way, on 10/1, you won't have to switch all your diagnosis codes. You won't have to map everything and get all the information from the doctors. You will be able to pre-stage those codes now, and that way in the system, and that way come 10/1, like I said, you'll basically just have to hit update, an ICD-10 button and enter your charges in as normal. So we'll also show you the charge entry service tickets, what that will look like. And then the main thing that we want to, emphasize is that in the system it's by date of service. So any date of service, obviously before 10-1, are going to be using ICD-9 codes. Any date of service 10-1 or after are going to be using ICD-10 codes. That's very important. And one thing that I've talked to a few front desk and doctors about is the importance of communicating, however you communicate the doctors to the front desk or whoever puts in charges. The doctor's going to have to communicate, which ICD-10s that they are wanting for each patient, because it's going to be more specific, and you're not going to want to have your staff or us guess which one it is. So that'll be required from all doctors' perspectives, not just chiropractors. It's doctors across the board. So, what I'm telling the doctors to do is, however you communicate to your person or anyone who enters your charges, whether that's a sheet of paper with the services or, just telling them, what we're recommending you doing from now until October 1st is start, along with your ICD-9s that you're currently telling them, include your ICD-9s and your ICD-10s in that communication to your front desk now. That way they can get those ICD-10s ready in the system, and there won't be a big mass chaos come 10-1 where the front desk is having to communicate to the doctor to see which diagnosis they want. So we're trying to eliminate the stress for you guys, and I think that's kind of the overview of what we're going to be showing you. So we can start showing you the software in Raintree of what that's going to look like, and I'm going to turn it over to Brandy, and she's going to show you the updates. And like I said, if you have questions at any time, go ahead and let us know in the chat section. Otherwise, Brandy will probably be opening it up for questions as she shows you the software updates. So Brandy, I'm going to turn it over to you, and you can start showing them the software updates.
Okay. Thanks, Mark, and hello, everybody. We'll be spending the remainder of our time today talking through those software updates that Mark mentioned and just showing you how to use some of the new features that have been built into Raintree. Today, we're starting with the diagnosis table. There's some really great features that are built into this table that will make selecting your diagnosis codes easier as we transition to ICD-10. The newest feature within this table is that it now contains both ICD-9 and ICD-10 code sets. So gone are the days where you have to actually add entries to these tables. Everything should be present for you. And again, just to reemphasize what Mark had already said, ICD-9 codes will be used through 9/30, and ICD-10 will be used beginning with October 1st dates of service. You'll now notice a column in this table that identifies which ICD-10, or excuse me, which ICD code set any particular diagnosis belongs to. So if we, for instance, look at a current ICD-9 code, we can actually click on that code. So in this example, I'm going to use the 7393. We can click on that code, and we're now presented with an ICD mapping tool. So if from this drop-down menu we select that ICD mapping, we can see that ICD-9 code 7393 best matches or best translates in ICD-10 to M99.03. Some codes have a one-to-one best match based on the general equivalency mapping, and some might have multiple matches that could be appropriate. This is going to be especially helpful for providers as you begin to memorize and learn these new codes. So at any given point in time, if you're not sure which ICD-10 code to use, but you recall the ICD-9 code, you can look up that ICD-9 code and find out what that best appropriate match is come 10/1. You'll also see we now have these, I call them purple bars. Those are category headers. These are non-billable codes that help to organize the table, and they help us to conduct wildcard searches. So we're going to get to that in a few minutes as we start to preload those ICD-10 codes in patient files. But it's just basically a way to organize the tables. The diagnosis table itself also has some helpful reports that will assist you over the next few weeks prior to the ICD-10 transition. I believe that each office received a copy of these reports when you signed up for the webinar, but just in case, we're going to show you how to print those again. These are going to be helpful for providers and staff as you learn those ICD-10 codes. So there's two reports that we found to be the most helpful during this transition time, and those are the most commonly used ICD-9 codes for your practice and the ICD-9 to ICD-10 mapping for those most commonly used codes. So we're going to go ahead and show you the process of how to print those, and you're welcome to print those on your end should you need additional copies for multiple providers within the office. So again, any printing of these reports is going to be done through the diagnosis table itself. So I've got my diagnosis table on the screen, and I'm either going to select this print button down at the bottom of the screen, or for those of you that use your quick keys, you'll hit the P key on your keyboard. We've got a series of options that pull up that we can print. We want the one that says commonly used diagnosis codes. Then we get a screen that asks for what parameters we might want to identify on our reports. We're recommending that providers go through the current date and time and ask for 97% of your most commonly used codes. This will give you a good indicator of the majority of ICD-9 codes that you're currently using so that you can familiarize yourself with the approximate ICD-10 matches for those codes. You won't need all of these reports that are checked. We found the most helpful to be the first two, and those are the reports that you all would have received up to this point. So those are the diagnosis code usage statistics and the ICD-9 to 10 general equivalence mapping on common ICD-9. So I'm going to go ahead and click my Save button at the bottom of the screen here. And those codes, or excuse me, those parameters will generate on the report for me. So we're just going to wait a minute while those prompt. And if I go ahead and I open those up, I'll be able to see that we've got two different reports here. The first one is the most common diagnosis codes. So this just shows any given practice, the current ICD-9 codes that you're using and with what frequency. So some of them are used with a lower frequency than others, so you want to familiarize yourself with the ICD-10 equivalents on the codes that have a higher percentage of usage. The second report is the common ICD-9 codes mapped to the ICD-10, and that is pretty much equivalent to this first report that we showed you. However, instead of just the ICD-9 code, it also has a table built into it where it shows you the best ICD-10 matches. So again, these are going to be helpful reports for the providers to have on hand over the next couple weeks as they start to assign those ICD-10 codes and basically translate that information to the front desk. So we're going to go ahead now and open up the line for anybody who might have questions in regards to the diagnosis table itself. If we don't have any questions, then we'll just kind of keep moving along. Do we have anybody out there that needs any clarification on the reports themselves or anything additional that you might be looking for? Over the phone? I think then we're going to go ahead and close the audio lines, and we'll move on. All right. So we're going to go ahead and move on to pre-staging our patient cases. And when we say pre-staging with ICD-10 codes, what we really mean is that we're just preloading the ICD-10 codes into patient cases over the course of the next couple of weeks so that come 10/1, we're ready with those ICD-10 codes for that transition. Again, kind of going off of what Mark had said, we're encouraging staff to preload these codes over the next few weeks so that on 10/1 the workload is much more manageable and we can continue here on our end with conducting billings, and then therefore cash flow doesn't become an issue. So we can't stress the importance of, providers that are on the line listening to this. It's so important for you to communicate with your staff. They won't necessarily know what to do for some of these patients unless you communicate that information to them. So we're going to go ahead and take a look at a sample patient file here, and we're going to go ahead and talk about how to go about preloading those ICD-10 codes. All of the preloading is going to be done through a patient's case history screen. So I'm going to go ahead and open that up. And I'm encouraging you over the course of the next couple weeks, some providers that are out there have multidisciplinary practices. So you might have multiple open cases for a patient at any given point in time. So you just want to make sure, providers, that you're communicating to your staff that if the patient is treating for several different conditions and maybe has several different cases that are open, that you're communicating those ICD-10 codes for the number of cases that the patient have, whether it be 1 or 2 or 10. So we're going to be working with current active cases. Come 10/1 dates of service, there will not be a need for us to start new cases. We're going to use the existing cases that are on file and open at that point in time. So we're going to work through a few examples, and then if needed, if you all have questions, we're going to open the lines again so that we can go ahead and address those questions. So if I pull up an existing case, we're actually going to open the case, and you can see that at this point in time, the diagnoses that are on file assigned to this case are currently ICD-9 codes. And that is going to remain true from now until 10/1 dates of service. But now you'll see we have this ICD-10 staging button here, and this is where we're going to do all of our ICD-10 prep work. So if we click on this ICD-10 staging button, again, you'll see these are our existing ICD-9 codes on file. It shows us in this column here that that is what's assigned to the case. And then we've got these little map to buttons here. These map to buttons are going to allow us to access the diagnosis tables so that we can find the corresponding ICD-10 matches to these ICD-9 codes. So I'm going to go ahead and click this map to button, and it will pull up the mapping features from the table that we talked about earlier, and it will show me that this ICD-9 code maps to M9901 as the ICD-10 code. So in order to map these two codes together for this particular patient, I'm just going to click this little checkbox here and say select. And again, some of these codes have a 1-to-1 mapping equivalent, and some have multiple matches. So for instance, the 722.0, if I click on this map to button, it's going to give me 4 possible matches. So providers, this is where you come in. You'll have to communicate to your staff which one is the appropriate one based upon the patient's course of treatment. On the flip side of that, staff, the doctors aren't going to necessarily know if you don't communicate to them as well. So it's a two-way street, so definitely make sure that you keep those lines of communication open. And I encourage you that if you are running into a situation where you have a patient with an ICD-9 code that maps to multiple ICD-10 codes, that staff, you're letting your providers know right away that you need the equivalent ICD-10 from these list of options so that you can go ahead and map that and you're not waiting until 10/1 to do so. If you're not sure, and staff, you have to check with your providers, you can leave all of these options blank and just hit this select button. And that will basically allow you to bypass that code until you have the information from the provider. So I'm going to go ahead and map these codes here. And again, these look like they're all one-to-one mappings, so I can go ahead and map. And just for clarity's sake, I'm just going to go ahead and say maybe this 722.0 corresponds with the M50.22. So I'm going to go ahead and map that. From this point forward, we've got this update ICD-10 to case button, but we don't want to select that quite yet because we want, from now until the end of September, these ICD-9 codes to remain on file. So rather than click this button, I'm just going to go down here to my Save feature and save this. This just allows me to pre-populate those codes so that come 10/1, I'm all ready to update. All I have to do on 10/1 is give it that final update. So if I were to go back into my ICD-10 staging area, I'll see that those codes had changed to be mapped, but yet we're still currently using ICD-9 until the end of September. So I'm going to go ahead now and go into the patient's ledger and just give you an example of a service ticket. And you should all know how to do that, so I'm not going to be too specific here. But for instance, if I wanted to put in a service for today's date, you'll notice that the ICD-9s are still populating on the service ticket. And we want it to be that way until we're ready to make that transition on 10/1. So I'm going to go ahead and just post a charge here. And we'll see that we don't get any additional prompts because the system recognizes us as still using ICD-9. Looks like we're doing good so far in regards to questions, so we're just going to kind of keep going. I'm going to show you a couple different features here and what you'll do come 10/1. So here we have another example of a case, and I'm going to go ahead and get it ready for ICD-10 staging. And I'm going to go ahead and click on those little map to buttons again. Everything here, for the most part, looks like it's got one-to-one mapping. So staff, if you have codes that have one-to-one mapping, those you don't necessarily have to correspond with the doctors on the one-to-one mapping. If you see a code that has one-to-one mapping, I encourage you now, between now and the end of the month, to go ahead and map those codes and just rely on your doctors for the ones that have multiple matches. We have a code here that does have a one-to-one match on it, but I can tell you that looking at the ICD-10 code, this maps to something that is just an unspecified code. So it's possible that maybe the providers don't necessarily want the one-to-one matches. There are other options out there, and I just want to make that clear, because if we do know that there's another option and we wanted to select that instead of the one-to-one mapping, we could actually type that code in this additional diagnosis box and override the one-to-one mapping that's present and select that. So say, for instance, I wanted to use one of our M codes. Rather than, actually, this would probably be a really good time to talk about wildcard searches, because there's so many different codes to choose from, and I don't want to spend all that time searching through the tables for you all to find something. But if we wanted to do a wildcard search, if we're not exactly sure what it is we're looking for, but we know that we don't want an unspecified code, we can pull up that diagnosis table through this additional diagnosis section. So if we go ahead and hit the tab key on the keyboard, we can do that wildcard search. And in order to perform a wildcard search, we'll do F for find, just like we normally do, but instead of typing the diagnosis code, we'll put an asterisk in front of the description that it is that we're looking for. So say, for instance, this osteoarthritis lower leg is something related to the knee. And maybe I want to isolate certain entries that are related to the right knee. I could give this 2 wildcard searches. And then I can hit enter. And you'll see down here in the lower right-hand corner of the screen, the system is trying to conduct the search, looking for all entries that are related to the right knee. So now I've got 436 records. I'm going to try to narrow that down again because I don't want to spend time looking through 436 records. So I'm going to actually do another wildcard search and type in osteoarthritis. And now I can see that I've got it narrowed down to 2 codes. So I've got either the right knee, or we should have, we've got either post-traumatic or primary. So I'm going to go ahead and say that this is unilateral primary. I'm going to go ahead and select that from the tables, and that will populate this M1711 diagnosis in, which will override the other options that we might have had. So I'm going to go ahead and hit my select key. And I don't want to quite update yet, so I'm going to go ahead and save one time. And then if I were to go back in, I can see that all of my ICD-10 staging is present. So for the staff that's out there listening, for the people who are kind of manning the front desk on 10-1, it's going to be up to you all to come in, make sure that those ICD-10 codes are pre-populated in your patient files, and you're going to be the ones who are actually updating that information to the case. So let's just pretend that on 10-1, we're going to come into a patient's case. We're going to open that up and go back to that ICD-10 staging area, and this time we're going to say update ICD-10 to case. That will now show us that instead of the ICD-9 codes, we've got those ICD-10 codes present. So I'm going to go ahead and save my work. And you'll see now that the ICD-9 codes changed to ICD-10. Sure.
So I just wanted to reaffirm what Brandy was saying. On October 1st, this is what you're going to want to do. You're going to want to go into the cases and have those pre-staged codes updated to the case. So why don't you just show them that one more time, Brandy, so they can understand. Sure. October 1st, this is what you're going to want to do.
So we're going to go ahead, and I'm just going to stage another case here for clarity's sake. So this is what you'll do prior to October 1st, is you'll have this all staged and ready to go. And then October 1st, when you're ready to enter October 1st dates of service, you'll come back into whatever case might be active at that current point in time. You'll go to your ICD-10 staging area, and you'll make sure that everything is mapped correctly. And if it is, then what you'll do is you'll click this ICD-10 update button here, and that will change these codes to the ICD-10 codes. And then you'll save your work. You'll notice that they change from ICD-9 to ICD-10, and then you'll save one more time. And then from there, you'll be ready to go into the patient ledger and enter dates of service 10-1. And you'll notice when I prompt a service ticket for 10-1 and I use that case that's been updated, I do have my ICD-10 codes present. And I can go ahead and post my charges as normal. If for some reason you do forget to map those ICD-9s to ICD-10s on 10-1 when you try to enter a service ticket, you'll get a prompt that warns you that ICD-10 is now in effect, and you'll have to go back into that patient's active case, pre-stage everything, and update the case before you can go ahead and enter your charges. On the flip side, I know that there are some clinics out there that might have some outlying charges or some things that they need to have backdated. So if you've already updated your case to ICD-10 codes and then you say, oops, I forgot to enter one charge line from September 16th, there is a way for you to go back and do that and enter it with ICD-9 codes. We're not going to talk about that today. We'll address that with clinic staff on a one-on-one basis. So during this transition time, if at all you have questions, we're encouraging you to get in touch with us here at TABS. We are going to be kind of keeping a close eye on the accounts from this end, making sure that things are staged and that they're staged correctly. We're also, during that transition week, we're going to be conducting multiple billings. So you might hear from us a little more than normal if we feel that there's additional information that we might need from you. We'll definitely be communicating that with staff. In addition to that, I want to encourage you, if after watching the webinar today, if you still feel like you need additional one-on-one support, just call us. We're here to answer any questions that you might have during this transition time. I'm going to turn it back over to Mark at this point. We're going to open up the lines for questions. If you all need another run through on how to do this procedure, then we can go ahead and do that. And then if not, he'll tell you what you can expect as far as the webinar recordings.
Okay, so as Brandy said, if you guys have certain questions or want us to run through a certain area again of the pre-staging, I'm going to open up the lines. Just go ahead and ask them on your phones. Obviously, we'll try to take one question at a time. Otherwise, yeah, we'll see what questions we have. So go ahead if you have any questions. Let us know.
Can we go over the pre-staging again, transferring the 9s to, transferring the 10s on when we're ready for it?
Absolutely. We're going to go in, and between now and the end of September, we're going to pre-stage our cases. So when we go in currently, we've got ICD-9 codes on file. Those are these codes right here that you're viewing on your screen. In order to stage, we're going to click this ICD-10 staging button, and that will show us the existing ICD-9 codes that we need to map to the corresponding ICD-10s. So we're going to click this Map To button, and then we can see here that this is our current code, the 7394, and then based on the general equivalency mapping that's published by CMS, the best appropriate code that would map to would be the M9904. So unless your doctor has given you something different, you'll click this box here to select that M9904. And then you'll say select, and that will transfer that ICD-10 code to this table here. So we're going to go ahead and do that for each consecutive ICD-9 code that we need to map. One thing I do want to point out is that come 10-1, everything has to be mapped to ICD-10 codes. We can't have a mixture of the two, otherwise our systems will prompt us and they will not allow us to bill out the claims. So here's another instance where I have an ICD-9 code and the general mapping equivalents tell me that it best maps to this M46.1. So I'm going to go ahead and select that and click my select button. And I'm going to do that for each consecutive code. And it looks like most of these have a one-to-one mapping. So I'm going to go ahead and just map the one-to-ones. And again, I just want to make you aware that just because something has only one match, that doesn't necessarily mean that there can't be another match that's more appropriate. So providers, that's where it's going to become important for you to review the patient's treatment notes and their active case that's on file and communicate to the staff if you think that there's an ICD-10 code that's more appropriate. Okay. And then at this point in time, between now and the end of the month, I don't want to update the case yet because I still need these ICD-9 codes. The patient comes in between now and the end of the month. So I'm just going to save it at this point. And that just tells me that if I were to go back into this ICD-10 staging area, I still have my ICD-9 codes assigned to the case. So when I enter service tickets, this is the information it will pull. But that I also have these codes that are ICD-10 ready so that come 10-1, I don't have to worry about populating all of that information again. They're ready to go. So on 10-1, you'll just come back into this case before you're ready to enter charges for data service 10-1. You'll go back to that ICD-10 staging area, and that's where you'll say update to case. And then what that does is it actually then transfers that information to the case. Okay? Does that answer your question? Was that Jackie? Okay. You're welcome.
That worked out great. Thank you.
You're welcome.
It looks like, let me see here. It looks like we have a question about the wildcard searches again.
Okay.
Maybe Brandy, if you want
Sure.
to see what the question is, it is review the wildcard searches again.
Wildcard searches, the way that I went about doing it was doing it right through the patient's file and case itself. It's probably easier to conduct a wildcard search through the actual diagnosis table. So I'm going to go ahead and I'm going to go back to the diagnosis table itself in order to do that wildcard search. So I'm going to hit my find key just as I normally would, but instead of using an actual diagnosis code, I'm going to search for certain keywords that I think might be in the description itself. So say maybe I wanted something that was related to the cervical spine, and maybe I'm specifically looking, well, we'll do it that way. We'll look for something related to cervical. So odds are that we'll get a pretty lengthy list of diagnosis codes. So we've got just over 1,100 records. So rather than looking through this table to find what it is I want, I can actually do another search that will search within these 1,100 records. So I'm going to go ahead and hit find again, and maybe I want something that's specifically related to C1. I can type in C1, and I'm not finding anything labeled that way. And that's probably because the description might have one or the other. But say, for instance, let's just say I wanted to look for something related to cervical and then fracture. I would use those little asterisks to be able to pull up those wildcards. So it's just a way to narrow down the number of entries that you have to look through. Because now in ICD-9, we've gone from 15,000 codes or so to ICD-10, which has over 100,000 codes. So the wildcard searches, you can really give the system a varied number of parameters to be able to narrow down those number of entries that you have to look through. And does that answer your question?
Yes, thank you.
Okay, you're welcome.
With cervical fracture of cervical.
Does anyone else have additional questions that you might have regarding the software, or scenarios that you've thought of.
Number. Or the number
Will you
just.
be faxing over to us kind of like a pamphlet of all this stuff printed on it too?
We'll actually be making the recordings of the webinar today available for you all to review.
Good.
So you'll have the ability to watch again, watch certain segments. And then we'll also encourage you that if you watch the webinar again and you still have questions and feel like you might need some additional one-on-one help, you're more than welcome to call us, and we can schedule a time, based on your availability to review some of those questions that you might have. Do we have anybody else that might have a question?
It looks like Dr. Whitaker asked, do we have to open a new case when adding a new code?
If you're adding a new code to an existing case between now and the end of the month, you should just be able to add that ICD-9 code to the existing case and then make sure that that is also mapped to the ICD-10. Now, the flip side of that is if you change the patient's diagnosis entirely, the staff would generally be creating a new case anyways. And if they're creating a new case, then they'll need to perform that ICD-10 mapping for that new case. Dr. Jason, does that answer your question? Okay.
All right. So I think that the majority of the scenarios, if you do have additional questions, like Brandy said, you guys can call us anytime. Brandy or I are a good resource. Otherwise, everyone here, the main people here, are definitely trained and can help you on the software. Mary S., Ellen, Mark G. So just give us a call if you have additional questions. Also, I'm going to just close this out here. Let's see. And I will give you additional resources as where you can find the webinar videos. Just give me one sec. Okay. Okay. How do I become a presenter? Okay. So just to kind of recap here and what we're going to be doing, we're going to be doing multiple billings that week of October 1st. October 1st is on a Thursday. We highly encourage you guys to have all of your data entry on that Wednesday night. I would, if I were you, I would have all your charges in on that Wednesday on 9:30. Have it in the system on 9:30. That way on 10/1 you will not have to go back and forth. It will be a much easier day on October 1st. So I would make sure you have all your charges up to date. That's what we're telling all of our doctors. We're going to be doing billings on 9:30, everything ready, ICD-9s, and then come 10/1 we're going to be doing billings as well, just to make sure that everything's going through. Like Brandy said, give us a call if you want to set up a time where you want to go through certain questions that you may have. The webinar videos, we're going to be doing a few different ones today and tomorrow, and we will have a video up for you guys probably by Friday. The link is right there. It's just tabsbilling.com/ICD-10. You should see that up there if you want to go back and reference it. Otherwise, I think that's pretty much it. Thank you all for joining us, and As we have said before, it's going to be crucial that you start pre-staging your codes in the next 2 weeks. That way, come 10/1, you'll all be ready to go. So thank you all for joining us, and if you have any questions, give us a call. Otherwise, have a great day, and we'll talk to you soon. All right. Bye-bye.
Thank you.